Would you like to strengthen your ability to self-heal and help others do this too? I'm Chris Johnston from the British Holistic Healthcare Association, and the gem I'd love to introduce today is the work of Dr David Reilly, who for decades has been a pioneer of research and practice around ways to promote self-healing. Here's a section of a talk he gave in 2024, which served as a great introduction to his work.
I was inspired by this story. Seeds were found in the permafrost, 30,000 years old. After many failures, the team found the right conditions. It's interesting, 2 key points. Error by error we learn. And you know those seeds germinated after 30,000 years. I began to wonder profoundly about the innate capacity of an organism in life to recover, strength, resistance. And this is a real plant of mine that I neglected, and it is. But I watered it, and look what it did. A gardener doesn't need to know what life is. I don't know what life is, I don't know about you, right? But you can become a master of working it. And I think that's our art form that we're pursuing. So this is my patient in front of me, and this is me when I'm unwell, and this is us. These would be the images that I would hold inside myself. This is the compass. This is a truth that transcends time. Life responds to nurture. And with nurture, life is strengthened by challenge. And thank God the plant knows how to grow. And then between the first and the second image, the leaves fell off, by the way. And it taught me even more. You might not see this, but look. Yeah? That's how healing begins. And look at nature. It doesn't fix dead wood. It goes for growth. And this is where these inspiring examples that we've been hearing, I think, are so profound. Another little aphorism that I've come to think of then is that the health triangle, everything of public health and outside in prevention, utterly critical, and everything of treatment when it fails, but there's a missing edge. It's just a way of expressing what we're discussing. And that missing edge is created by the living gap. And our work is about closing this gap and bringing into awareness this innate strength of life itself and of healing capacity. So I worked in the pain relief clinic at one point, and the deal is I would see people if the clinic failed to help them. I would sit with people for which there was no fix-it, the toolbox was bust, and we'd take it from there, see what would happen. And I was developing what I called a therapeutic encounter as best I could, something that I did a lot of teaching around. And I had a successful meeting with a woman, and I said, this was the mid-80s, and I said nervously, would you mind if in view of what we've just done together, I didn't prescribe anything? She said, Doctor, that would be wonderful. You know, all people want to do is give me things and inject me and so on. So she came back 4 weeks later and described a transformative change. And my jaw hit the floor. Because I realized if I had done anything, both she and I would have attributed it to the intervention and completely disempowered the situation. Now, I had been studying hypnoanalysis and the placebo literature, and I began to reframe this into the innate healing response, the human healing response. And how can it be engaged? What can it achieve? And what are its limits? And what obstructs it? When is it safe to rely on it? And so on. So that becomes a field of study, and one that I hope very much our younger generation will pick up, a direct study of human healing. Let me just show you in action. I scaled up in 2004 into group-based work and to see if these principles could be applied there. And here's someone attending the group, which is a healthcare worker, 36 years of depression, and as you can see, desperate, dysfunctional, struggling situation and predicament. And 3 months after doing what would be a 20-hour course called the Well program, over a number of weeks. The doctorate researcher sat with her and spoke of this profound transformation in this individual, manner and bearing, upbeat. Everything changed. The plant knows how to grow, doesn't it? It puts out multiple leaves when there's a deep healing response within a human being. Changed awareness and ways of being. And what I did, which you could maybe do for a few seconds, here's the quotes from her, is I reversed engineered off of success. And I used that as the compass. That was the teacher. No theory, no model. And if I said, would you please teach me about this, became a standard thing I would do with my patients. How has this come about? What do you think helped it? When did it begin? How quickly did it develop? What stages has it gone through? You know, you would like you do with the natural history of a disease. Exactly that. So what do you think, if she was your only witness and you wanted to help other people, what could she teach you that you're going to bring to others? So the whole way I look and see things and feel things are different. So now I know that the healing shift is going to involve a profound movement of perception, and that perception is going to cascade into the emotions and into the behaviors and so on. And so as a practitioner, we can begin to sweat around what is perception, what shapes it, and what helps people move in their perception. And that can begin to inform the practice in some way. These are validated measures tracking the same thing over a year. And at the end of 12 months, it's sustained its change. And she speaks of not needing antidepressants for the first time in her life. This is healing in action. There's nothing esoteric about it. There's nothing over philosophical about it. It's as robust as that plant. Human beings can do this. Can you imagine a service that included at its core that missing edge of the triangle? So come in, is it a situation we need to intervene or not? And we weigh that up. What is to be done to begin to release the innate strength within this individual or this community? And you please notice, and it's not remotely to diminish the importance of change in circumstances, change in community, social prescribing. All of this occurred without a change of external circumstance. This was an internal transformation, which then shifts the whole scene, the whole picture from that point onwards. And I say there is always, always capacity for growth and transformation and release from suffering within a human being, even at times in the face of irredeemable external circumstances. Briefly, so too in the hundreds of people that we've tracked, this is stripped of the science, but these are clinically and statistically significant improvements over 9 months in growing self-sustaining improvements in self-care, psychological well-being, coping, enablement, self-compassion. This is possible. We can do this. We also saw terrible baseline markers for the pandemics. Almost half of people suspicious are actual pre-diabetes. Only 8% above a minimum level of omega-3, 92% below suboptimal vitamin D levels. People, what chance? What chance when COVID hits? Where on the daily briefings was the third edge of the triangle? Where did it tell us that, do you know you can drop your insulin and your inflammation beginning within 48 hours? Where was the daily hints and tricks and so on? Why not? Because it's not embedded in the map. See, and I'm not criticizing anyone. It's not been inherent in the last 300 years of the industrial and medical and scientific revolution. And so it's not reflexly arising. After it, rapid, dramatic changes that human beings can achieve. And long-term effects. Just to say this is a follow-up, a mean of 20 months, showing marked improvements. And I'm just going to finish on a little bit now of a flourishing image. Okay, We know the real food, the stress reduction, the mindfulness, the calming of the mind, the warming of the heart, and wonderful. But equally, I think there are deep drivers at the roots of the changes that Carol showed us. And for me, the last point I'll rest on is the issue of self-compassion, which, as you can see here, rose and correlated powerfully with the other improvements in this work. But actually, I've come to obscure that word self. Self-compassion is a difficult concept. I like to say to people, don't love yourself, it's too difficult, because we hate ourselves and we're conflicted and we're guilty and we're confused and so on and so on. I'm using the term life compassion. And in order to induce this as an inherent quality, I think one can powerfully use the image of the other. Why, people, would you not dream of treating a dog the way you treat yourself? Why would you not feed a child the junk food that you take, or berate it as it grows with the mental thing that's going on in your head? You wouldn't do it, would you? I think therein lies a real secret, a real key. And sometimes we have to use this image of the other to provoke what I would call the nurture response. There is an innate nurture response that is as powerful and prevalent as the fight or flight response. And when it's mobilized, it has the power to begin the reshaping of the default network. There is the emotional and passional weight behind it and the driving wisdom that will carry us through.